Last year's conference was a resounding success, and although the pandemic forced us into a world driven by technology, we see it as an even greater opportunity to reach and engage more people.
Welcome you to the University of South Carolina's second annual National Big Data Health Science Conference. The theme of this year's conference, Unlocking the Power of Big Data in Health, Bringing the Innovation into Improved Care and Prevention, is relevant to the COVID-19 pandemic our nation and the world is facing today.
The two-day conference is packed with renowned speakers, leading sessions that provide current information and practical learning from across academia, industry, and government.
I'm going to tell you a little bit about what we are doing at NIH and what we have done over the past 11 months.
And I would like to share with you some of our important research on integrating big data into theory and applications on health behavioral change.
Reading between the tweets about using social data to predict and change health behaviors.
How we operationalize analytics in veteran healthcare.
Our innovation think tank headquarters at Siemens Healthineers about how do we generate requirements for various healthcare system stakeholders using disease pathways.
This breakout session on the promise of big data in healthcare, improving diagnosis, treatment, and outcomes.
So personalized drug discovery and healthcare generate detailed data. These data are critical to create a learning health system for individualized disease prevention and therapeutic.
Was we built an unsupervised machine learning approach to detect content related to people self-reporting their own COVID-related experiences.
Now, when we do this, I'll talk very briefly about the intuition of how these models work, and I'll mention a generalized random forest is a simple example of sort of this intersection of machine learning and econometrics.
Breakout session on health geography and infectious diseases.
We also see issues related to what is in fact represented on the map.
Putting this in context and comparing it with public health outcomes, it's possible to develop some insights. So here, these are the percent of populations living with severe housing cost burden.
So you can see the areas in yellow, which are the lowest access, tend to be in the south.
You can see that the counties close to the regional county, we have a higher, stronger connectivity between these two counties.
This breakout session on mining social media big data for health applications.
Around 15% of the adult population have experienced some degree of depression. Therefore, we would like to use social media data to model user behavior so that we can discover users with potential mental disorders.
We have a very exciting panel of speakers arranged for you.
In this assay, we are using BioID2. This is a bacterial biotin ligase.
For these proteins, we use a templating mechanism to basically outline what's the most plausible region and how these areas do actually relate to facilitating mechanisms for binding to active site exposure.
And what we saw, we did that with 13 out of the 15 genes because in 2 we were not able to identify expression in this database, and what we saw was that again we had two groups being discriminated by this signature.
The center is interested in funding pilot project proposals.
We want to promote interdisciplinary collaborations in big data health science research and support researchers who are endeavoring to learn new skills and apply them in their respective fields.
Since EEG requires considerable expertise of the specialist reading the signals, MRI has become a critical tool in the evaluation of drug-resistant epilepsy patients undergoing pre-surgical assessment.
Despite the fact that we have many variables that we measure routinely on these patients, and using standard statistics, we cannot improve beyond these variables, even when you add other variables.
For the research team to create treatment knowledge graphs from the patient topic models to further define and refine the semantic domain represented in the clinical encounter notes.
Within the research community,
So we know that social determinants of health matter for improving health outcomes, but we have a lot less evidence about what it should look like and how health systems should intervene on these issues.
I'm here to talk to you today about the data holdings that are housed at SC Revenue and Fiscal Affairs, along with the various resources that we may be able to provide.
Here we have a dashboard that we've designed for our public website. All the data is public data sources, including the census, as well as the local government annual financial report.
It uses data mining techniques to quickly reconstruct the protein sequences using distilled data from Protein Data Bank, PDB, acquired by PDB Mine software.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you. Please stay and enjoy the closing remarks by Dr. Steve Cattler, Dean of the University of South Carolina College of Pharmacy, in a few seconds.